class, welcome to Chapter 23, Gynecologic Emergencies. After students complete this chapter and the related coursework, they will understand the anatomy and physiology, including the developmental changes between puberty and menopause of the female reproductive system, and identify and describe assessment and treatment for gynecologic emergencies, special conditions, and precautions that an EMT must observe when arriving at the scene of a suspected case of sexual assault or rape are also discussed. Introduction. Women are uniquely designed to conceive and give birth. Women are susceptible to a number of problems that do not occur in men. Anatomy and physiology. The female reproductive system includes internal and external structures. External female genitalia. The vaginal opening is just posterior to the urethral opening. The labia majora and the labia minora are folds of tissues that surround the urethral and vaginal openings. The clitoris is at the anterior end of the labia. The anus is at the posterior end of the labia. The perineum is the area of skin between the vagina and the anus. This figure shows the external female genitalia. Internal structures. The ovaries are the primary female reproductive organs. Ovaries lie on each side of the lower abdomen and produce an ovum, or egg. A fetus develops from the fertilized ovum. Fallopian tubes connect each ovary with the uterus. The uterus is a muscular organ where the fetus grows during pregnancy. The narrowest part of the uterus is the cervix, which opens into the vagina. The vagina is the outermost cavity of a woman's reproductive system. It forms the lower part of the birth canal. This figure shows the internal female genitalia. When a female reaches puberty, she begins to ovulate and experience menstruation. The onset of menstruation is called menarche. It usually occurs between age 11 and 16 years. Any female who reaches menarche is capable of becoming pregnant. Women continue the cycle of ovulation and menstruation until they reach menopause. Menopause marks the end of menstrual activity and usually occurs around age 50. Each ovary produces an ovum in alternating months. Each month, one ovum is released into the fallopian tube. This process is called ovulation. Some women experience minor cramping pain during this release period. The process of fertilization begins in the vagina. Sperm are deposited into the vagina from the male penis. Sperm pass through the cervix into the uterus and eventually up the fallopian tubes. When an ovum is fertilized in the fallopian tube, the developing embryo travels into the uterus. The embryo attaches to the uterine wall and continues to grow. If fertilization does not occur within about 14 days of ovulation, the lining of the uterus begins to separate and menstruation occurs. The menstrual flow consists of blood from the separated lining of the uterus and lasts about 1 week. Female hormones, produced primarily in the ovaries, control the process of ovulation and menstruation. Pathophysiology. The causes of gynecologic emergencies are varied, ranging from sexually transmitted diseases to trauma. You should recognize and properly manage female patients with any kind of abdominal or pelvic pain. Pelvic inflammatory disease, PID. Infection of the upper organs of reproduction. Uterus, ovaries, fallopian tubes. Occurs almost exclusively in sexually active women. Disease-causing organisms enter the vagina and migrate into the uterine cavity. If infection expands to the fallopian tubes, it will cause scarring. Can result in increased risk of ectopic pregnancies or sterility. Ectopic pregnancy is pregnancy that develops outside the uterus and can be life-threatening. If infection expands to ovaries, it can lead to the development of a life-threatening abscess. Most common presenting signs of PID is generalized lower abdominal pain. Other signs include abnormal or foul-smelling vaginal discharge, increased pain with intercourse, fever, general malaise, and nausea and vomiting. Sexually transmitted diseases. STDs can lead to more serious conditions, such as PID. Chlamydia, the most common STD in the United States, caused by bacteria, usually mild or absent symptoms. Some women may report lower abdominal pain, low back pain, nausea, fever, pain during sexual intercourse, or bleeding between menstruation periods. Infection of the cervix can spread to the rectum and can progress to PID. Bacteriovaginosis, the most common vaginal infection to affect women ages 15 to 44 years. Normal bacteria in the vagina are replaced by an overgrowth of other bacteria. Symptoms include itching, burning, pain, and a fishy, foul-smelling discharge. Untreated, it can lead to premature birth or low birth weight in case of pregnancy, make the patient more susceptible to other serious infections, and cause PID. Gonorrhea, caused by bacteria that grow and multiply rapidly in warm, moist areas of the reproductive tract. Cervix, uterus, fallopian tubes in women, the urethra in men and women. Bacteria can also grow in the mouth, throat, eyes, and anus. Symptoms are more severe in men than women. Women may present with painful urination, burning or itching, yellowish or bloody vaginal discharge, and blood associated with sexual intercourse. Severe infections present with cramping and abdominal pain, nausea, vomiting, and bleeding between periods. These symptoms indicate it has progressed to PID. Untreated, it can enter the bloodstream and spread to other parts of the body, including the brain. Vaginal bleeding. Bleeding may be considered menstrual bleeding and overlooked. Possible causes include abnormal menstruation, vaginal trauma, ectopic pregnancy, spontaneous abortion, cervical polyps, and cancer. Patient assessment. Obtaining an accurate and detailed assessment is critical when dealing with gynecologic issues. You will be able to gain only a primary impression of the problem in the field, but through patient assessment will help determine how sick the patient is and whether life-saving measures are needed. Anyone who neglects to consider a gynecologic cause in a woman of childbearing age who complains of abdominal pain will miss the diagnosis at least 50% of the time. Scene size up. Scene safety. Is the scene safe? Will you need assistance? How many patients do you have? What is the nature of the illness? Have you taken standard precautions? Gynecologic emergencies can involve large amounts of blood and body fluids potentially contaminated with organisms that can cause communicable diseases. Where or in what position is the patient found? Is she at home? What is the condition of the residence? Is it clean, filthy, or wrecked? Did you see any evidence of a fight? Are alcohol, tobacco products, or drug paraphernalia present? Does the patient live alone or with other people? If a crime scene, you may be required to testify in court regarding the conditions on your arrival. Your documentation needs to be accurate and thorough. Involve the police if any type of assault is suspected. In cases of sexual assault, it is important to have a female EMT to provide patient care. Mechanism of injury, MOI. The MOI in some patients with gynecologic problems may be easily understood from the dispatch information, such as sexual assault. In other patients, patient history may reveal the nature of the condition. Primary assessment. Form a general impression. Is the patient stable or unstable? Use the AVPU scale to determine the patient's level of consciousness. Airway and breathing. Always evaluate the airway and breathing immediately to ensure they are adequate. Circulation. Palpate a pulse and evaluate skin color, temperature, and moisture to help identify blood loss in a patient. If there is significant blood loss, the patient may not be demonstrating obvious signs of shock, but may still be hypovolemic. Most cases of gynecologic emergencies are not life-threatening. If patient has signs of shock, a weak or rapid pulse, or pale, cool, diaphoretic skin, then rapid transport is warranted. History taking. Investigate the chief complaint. Some questions may be extremely personal to the patient. Be sensitive to the patient's feelings and protect her privacy and dignity. An adolescent girl may want to keep her sexual history private. For abdominal pain, ask about onset, duration, quality, and radiation, provoking or relieving factors, and associated symptoms such as syncope, lightheadedness, nausea, vomiting, and fever. For vaginal bleeding, ask about onset, duration, quantity, number of sanitary pads soaked, and associated symptoms such as syncope and lightheadedness. Sample history. Make a note of any allergies or medications she may be taking, birth control pills and devices. Ask patient about medical conditions and the last menstrual period. This will help demonstrate possible pregnancy. Also ask about possibility of STDs. Secondary assessment. Secondary assessment may be performed on scene or en route to the emergency department, or if time is limited, not at all. Pertinent secondary assessment findings should include vital signs, blood pressure, pulse, skin color, orthoscopic vital signs, abdomen distension and tenderness, visual bleeding, neurologic mental status. Physical examinations should be limited and professional. Only examine the genitalia if it is necessary to do so to treat the patient. Protect the woman's privacy. Few women are comfortable with having their body exposed. Limit the personnel present. Be an advocate for her modesty. Focus your physical examination on the NOI and the patient's chief complaint. For vaginal bleeding, visualize the bleeding and ask about quality and quantity. Use external pads to control vaginal bleeding. Keep the possibility of hypoperfusion and shock in mind. Always ask if there is pain associated with the bleeding. Never insert anything into the vagina to control bleeding, even a tampon. Observe for vaginal discharge. Make observations about the discharge. Fever, nausea, and vomiting are considered significant in gynecologic emergencies. Syncope is considered significant. Treat as being in shock until proven otherwise. Vital signs. Assess the patient's heart rhythm, heart rate, and quality. Respiration rate, rhythm, and quality. Skin color, temperature, and condition. Capillary refill time. Blood pressure. Consider obtaining orthoscopic vital signs if bleeding is known or suspected. Pay special attention to the presence of tachycardia and hyperperfusion. Could indicate hemorrhagic shock. Monitoring devices. Use pulse oximetry. Consider using non-invasive blood pressure monitoring to continuously track patient's blood pressure. It is always recommended to assess the patient's first blood pressure with the styomatic and stethoscope. Reassessment. Repeat the primary assessment. Reassess the patient's vital signs and chief complaint. Identify and treat any changes in the patient's condition. Pay specific attention to the needs of your patient. Accommodate her desire for conversation or silence. Interventions. There are very few interventions with a gynecologic emergency. For vaginal bleeding, treat for hypoperfusion or shock. Keep the patient warm. Place the patient in the supine position. Provide supplemental oxygen. Consider ALS, intercept for fluid replacement, and transport promptly to the hospital. Communication and documentation. Communicate all relevant information to the staff at the receiving hospital, including the possibility of pregnancy. Carefully document everything, especially in the cases of sexual assault. Patient's condition, chief complaint, scene, all interventions. Emergency medical care. Maintain the patient's privacy as much as possible. If in a public place, move her to the ambulance. Have a female EMT participate in the patient's care if possible. Excessive internal vaginal bleeding. Determine the cause of bleeding if it is of less importance than treating the patient for shock and transporting her. Most women will use sanitary pads to control bleeding before you arrive. Use sanitary pads on external genitalia to absorb the blood. Document the number of sanitary pads that were saturated with blood. If woman has a tampon in place, it is not necessary for it to be removed. The external genitals have a rich nerve supply. This makes injuries to the area very painful. Treat external lacerations, abrasions, or tears with sterile compresses. Use local pressure to control bleeding. Use a diaper-type bandage to hold dressings in place. Under no circumstances should you pack or place dressings in the vagina. Assessment and management of specific conditions. Pelvic inflammatory disease, PID. A patient with PID will complain of abdominal pain. Pain usually starts during or after normal menstruation. Inquiring about the date of last menstrual period is important. The pain may be made worse by walking. Patients often present with distinctive gait that appears as a shuffle. Pre-hospital treatment is limited. Non-emergency transport is usually recommended. A PID itself is seldom a threat to life, but it is serious enough to require transport and evaluation in the hospital. Sexual assault. Sexual assault and rape are common in the United States. 1 in 5 women has reported being raped. 1 in 4 women have been sexually molested, often before the age of 12. EMTs called on to treat a victim of sexual assault face many complex issues. Issues range from obvious medical ones to serious psychological and legal issues. You may be the first person the victim has contact with after the encounter. How you manage the situation may have lasting effects both for the patient and for yourself. Professionalism, tact, kindness, and sensitivity are important. When performing your assessment, be aware of drugs used during sexual assault or rape to incapacitate a person. Inability to remember the event should create suspicion. If these drugs are still in the patient's system, you may see hypotension, bradycardia, abdominal complaints, difficulty breathing, seizures, coma, and even death. You can generally expect law enforcement involvement. Attempts to immediately gather a detailed report from the victim may cause her to shut down. If possible, give the patient the option of being treated by a female EMT. Your focus. Medical treatment of the patient. Is she physically injured? Are any life-threatening injuries present? Does the patient complain of any pain? Psychologic care of the patient. Do not pass judgment on the patient. Protect her from judgment of others on scene. Preserve evidence. Do not cut through any clothing. Do not throw away anything from the scene. Place blood-stained clothing or anything else that could be evidence in separate paper bags. It may be necessary to persuade the patient not to clean herself. Doing so can destroy evidence. Patients should also be discouraged from urinating, changing clothes, moving her bowels, or rinsing out her mouth. She will be photographed and examined by nurses trained in sexual assault examination and management. Often offer to call the local rape crisis center for the patient. Getting a professional advocate to the scene may help the patient deal with the trauma. Take the patient's history and limit any physical examination to a brief survey for life-threatening injuries. The patient report is a legal document and may be subpoenaed. Keep the report concise and record only what the patient stated in her own words. Do not insert your own opinion. Use quotation marks when reporting the patient's version of events. Focus on the facts. Bear in mind that rape is a legal diagnosis, not a medical diagnosis. This table shows treatment principles for victims of sexual assault. Okay, class, let's go over a few review questions. Review question number 1. What is the narrowest portion of the uterus? A. Vagina, B. Cervix, C. Fallopian tubes, or D. Ovaries? The correct answer is B. The ovaries are the primary female reproductive organ. The developing embryo travels into the uterus through the fallopian tube. The embryo attaches to the uterine wall and continues to grow. The narrowest portion of the uterus is the cervix, which opens into the vagina. The vagina is the outermost cavity of the woman's reproductive system. B. Cervix is the correct answer. The fallopian tubes are not part of the uterus. They connect each ovary with the uterus. The ovaries are located on each side of the abdomen and are not part of the uterus. Review question 2. What is the outermost cavity of a woman's reproductive system? A. Cervix, B. Ovaries, C. Vagina, D. Uterus. The correct answer is C. The vagina is the outermost cavity of a woman's reproductive system. The cervix opens into the vagina, sperm passes through the cervix to the uterus and up the fallopian tubes. The ovaries are located on each side of the lower abdomen. The correct answer is C. The uterus is a muscular organ where the fetus grows during pregnancy. Review question 3. If fertilization has not occurred within about blank days following ovulation, the lining of the uterus begins to separate and menstruation occurs. A. 8, B. 10, C. 12, D. 14. The correct answer is D. When women menstruate about 14 days following ovulation. Women menstruate about 14 days following ovulation. This is different from woman to woman, but it's roughly about 14 days. D is the correct answer. Review question 4. The onset of menstruation is called A. Menopause, B. Menarche, C. Ovulation, D. Bleeding. The correct answer is B. Menarche is the onset of menstruation typically occurring between ages 11 and 16. Menopause is when the cycle of ovulation and menstruation ceases. B is the correct answer. Ovulation occurs each month when one ovum is released into the fallopian tube. D. Premenstrual syndrome involves symptoms that typically occur before menstruation. Review question 5. Which of the following can cause vaginal bleeding? A. Ectopic pregnancy, B. Spontaneous abortion, C. Trauma, D. All of the above. The correct answer is D. Ectopic pregnancy, spontaneous abortion, and trauma can all cause vaginal bleeding and should not be overlooked. Ectopic pregnancy can cause vaginal bleeding, so can spontaneous abortion, so can trauma. The correct answer is D. What is the most common presenting sign of PID? A. Vomiting, B. Vaginal discharge, C. Lower abdominal pain, D. Fever. The correct answer is C. Lower abdominal pain is the most common sign of pelvic inflammatory disease. Vomiting is considered to be another sign of PID, so is vaginal discharge. The correct answer is C. Fever is also considered to be another sign of PID, but they're all later signs. When obtaining a sample history, which of the following pieces of information is important to obtain? A. Use of birth control device or birth control pills, the date of the patient's last menstrual period, the possibility of pregnancy, D. All of the above. The correct answer is D. When obtaining a sample history, the EMT should inquire about the patient's medications. The EMT must ask about the use of birth control pills or birth control devices, and ask specifically about the patient's last menstrual period. The EMT should also inquire about the possibility of sexually transmitted diseases and the possibility of pregnancy. The EMT should also inquire about the possibility of pregnancy and the date of the last menstrual period. The EMT should also inquire about the use of birth control pills, devices, and the possibility of pregnancy. The EMT should also inquire about the use of birth control pills and devices and the date of the last menstrual period. D is the correct answer. Review question 8. What is the EMT's first priority when dealing with a patient experiencing excessive vaginal bleeding? A. Determine the cause of bleeding. B. Treat the patient for shock and transport. C. Determine if the bleeding is a result of sexual assault. D. Keep the patient warm and apply oxygen. The correct answer is B. Determining the cause of the bleeding is less important than treating for shock and transporting the patient. EMTs can control the bleeding by using sanitary pads on external genitalia. When treating for shock, the EMT must place the patient in an appropriate position, keep her warm, and apply oxygen. Determining the cause of bleeding is less important than treating for shock and transporting the patient. The correct answer is B. Determining the cause of bleeding, this information will be handled by the hospital staff and police. This step is the only part of treating the patient for shock. Which of the following drugs is commonly used to facilitate sexual assault? A. Rapidol. B. Heroin. C. Cocaine. D. Marijuana. The correct answer is A. Rapidol is a sedative that is used by criminals to facilitate sexual assault by depressing the victim's central nervous system. A is the correct answer. Heroin is not used to facilitate sexual assault. The same goes for cocaine and marijuana. Review question 10. You should discourage a rape or sexual assault victim from doing which of the following? A. Urinating. B. Cleaning yourself. C. Changing clothes. D. All of the above. The correct answer is D. A victim of sexual assault or rape should be discouraged from showering, urinating, changing clothes, moving bowels, or rinsing out her mouth in order to preserve evidence. The victim should not urinate in order to preserve evidence. They should clean themselves, again, to preserve evidence. Changing clothes should not be done in order to preserve evidence. The correct answer is D, all of the above. And this concludes the lecture on Chapter 23, Gynecologic Emergencies. Thank you for listening. If you have any issues or questions, please contact your instructor, and I will see you in the next chapter.